Hair transplantation is a minimally invasive procedure that moves hair follicles from a donor site to areas of the scalp where there is hair loss or thinning. While many factors can contribute to hair loss, the most common cause is androgenetic alopecia, also known as male or female pattern hair loss. This type of hair loss typically affects specific areas of the scalp, including the hairline, the top, and the crown. Androgenetic alopecia is influenced by a hormone called dihydrotestosterone, or DHT, which can cause susceptible hair follicles to gradually miniaturize over time. Hair follicles along the back and sides of the scalp are generally more resistant to the effects of DHT and are therefore less susceptible to thinning, allowing them to be used as a donor source for transplantation into areas of thinning or hair loss. For appropriately selected individuals, hair transplantation can be an effective and long-lasting solution. Not everyone is an ideal candidate for hair transplantation. Factors such as age, the degree and pattern of hair loss, the rate of hair loss progression, and donor hair availability all play an important role. In some cases, prescription medication, such as finasteride and minoxidil, may be more appropriate, either alone or in combination with a surgical procedure. Performing an aggressively designed hair transplant at a young age, particularly in the setting of ongoing rapid hair loss, can lead to unnatural results over time. As native hair continues to thin, transplanted hair may remain in place, potentially creating isolated areas or islands of transplanted hair that no longer match the surrounding scalp. In addition, the donor supply is limited and may not be sufficient to keep pace with future hair loss, particularly in younger patients. It is therefore critical for an experienced hair transplant surgeon to design the hairline, which will likely remain permanent, with careful consideration of potential future hair loss. A thorough evaluation by an experienced hair transplant surgeon is necessary to determine the most appropriate treatment plan for each patient. During the procedure, patients are typically seated or lying down comfortably while listening to music or watching media. Hair transplantation is performed under local anesthesia, which is administered to help patients relax, allowing them to remain comfortable but responsive throughout the process. Depending on the specifics of the case, the procedure usually takes about 4 to 6 hours, and short breaks may be taken for comfort as needed. There are two main methods utilized when performing hair transplantation: follicular unit transplantation, or FUT, also known as linear strip excision, or LSE, or strip surgery, and follicular unit extraction, or FUE, also known as follicular unit excision. While both methods involve relocating hair follicles from the donor area to areas of thinning or baldness, they differ in how the follicles are harvested. During FUT, a surgeon removes a thin strip of tissue at a shallow depth within the skin. Next, the donor area is closed using a precise suturing technique, and the strip is dissected into individual follicular units by specialized hair transplant technicians. During FUE, individual follicular units are extracted directly using specialized punches, which are typically less than 1 millimeter in diameter, leaving small sites that heal without sutures. Regardless of the method used, the goal is to obtain healthy follicular units that can be transplanted into areas of hair loss. FUE avoids a linear scar and may allow patients to wear their hair shorter, whereas FUT may require slightly longer hair in the donor area for optimal coverage. Once the follicular units have been removed and prepared, the next steps are recipient site creation followed by graft placement. This is one of the most critical parts of the procedure. Using specialized microblades or similar instruments, your surgeon will create the recipient sites with careful attention to design, angle, direction, and depth in order to replicate natural hair growth patterns. Once the recipient sites have been created by the surgical team places the grafts into these sites one at a time. These sites are distributed in a carefully designed, varied, and individualized pattern that mimics the natural variation seen in native hair growth. The goal is to create a result that appears natural, both in the short term and over time. It is uncommon to experience serious complications from hair transplantation. Rare potential risks may include infection, post-operative bleeding, or unfavorable scarring. When performed by an experienced hair transplant team using proper technique and with adherence to recommended post-operative instructions, these potential occurrences are very uncommon. Hair transplantation is an outpatient procedure, and you will be able to return home the same day. Following the procedure, some redness, swelling, and scabbing are expected to develop in the transplanted areas, all of which typically resolve within the first 10 days. You may experience some swelling around the forehead or eyes in the first week following the transplantation, which typically subsides within a few days. Appropriate use of a loose-fitting hat that does not contact the transplanted follicles can help camouflage these temporary cosmetic changes and may also provide some protection to the grafts from incidental contact. Non-contact rinsing can begin as early as the first day after the procedure, but do not touch the transplanted follicles. Patients can generally resume normal shampooing around 10 days, which also helps facilitate the natural removal of scabs. A topical antibiotic ointment is typically applied to the donor area for approximately 10 to 12 days. With some basic precautions, most patients are able to resume normal daily activities as early as the following day. Haircuts may be resumed after approximately 10 to 14 days. Typically, exercise can be resumed between 10 days and 4 weeks, depending on the specifics of the case and the type of procedure performed. In the first few weeks, a temporary shedding phase known as shock loss often occurs, during which the transplanted hair shafts fall out, while the follicles themselves remain intact beneath the skin. Over time, the follicles enter a resting phase before gradually producing new hair. Final results are generally achieved within approximately 12 to 24 months.